Around 575,400 people died from swine flu in 2009. Where does swine flu come from? According to the CDC, swine flu comes from pigs. This disease agent is referred to as H1N1, or variations of this. People who get swine flu have either come into contact with an infected pig or with an infected human. There is an increased risk for people who work in the swine industry. Geographically, it's located where there are large populations of pigs. A helpful acronym to remember how to be safe around animals is KNOW. K representing know that animals carry germs that can make you sick. N representing never eat, drink, or put things in your mouth in animal areas. O standing for older adults, pregnant women, and young children should be extra careful around animals. And finally, W representing wash your hands with soap and water right after visiting animal areas. People at high risk for swine flu complications include children under 5, adults over 65, pregnant women, and people who have long-term health complications such as asthma, neurological and neurodevelopment conditions, including those with brain, spinal cord, peripheral nerve, and muscle disorders, people with chronic lung disease, heart disease, blood disorders, kidney disorders, liver disorders, or metabolic disorders, people with weak immune systems, people that are younger than 19 and are on long-term aspirin therapy, and those with chronic obstructive pulmonary disease, also known as COPD. It is crucial for those with a chronic lung disease to avoid contracting these symptoms, as this could lead to pneumonia. Those of elderly age or who are immunosuppressed are more susceptible to contracting the symptoms of the swine flu. People with pre-existing conditions should be extremely precautious, as the H1N1 virus can lead to other health complications. The CDC warns people at high risk to stay away from pig barns and habitats. The CDC uses rapid influenza diagnostic testings, also known as RIDTs, to decipher between the different strands of influenza viruses by using methods such as, but certainly not limited to, a nasal swab, throat swab, bronchial wash, and endotracheal aspirate. RIDTs can help a doctor quickly diagnose whether you have swine flu or not. This virus is mainly spread from human to human through indirect contact. The most common method of transmission is when an infected person with the H1N1 virus produces droplets from sneezing or coughing, which land on surfaces such as doorknobs or books. Then, a healthy person has to come into contact with surfaces contaminated with the flu virus and proceed to touch their eyes or nose to become infected. The CDC shows that the H1N1 virus can infect a healthy person after living on surfaces such as doorknobs and desks anytime from 2 to 8 hours after the virus was spread to that surface. According to the CDC, the rate at which infected people can transmit the virus to others can be any time from 1 day prior to getting sick to 5 to 7 days after getting sick. So one is able to spread the swine flu before they even know they are infected. This time frame could be longer for certain people depending on different host factors, like different strengths of the immune system. Swine flu is reported to have symptoms similar to the seasonal flu. Symptoms such as muscular pain, fever, chills, headache, cough, and nausea are the most commonly reported. You begin to show symptoms after 24 hours and are contagious for the next 4 to 6 days, on average 5. Many ways to control the spread of swine flu include taking time off of work or school to stay home and away from people for 24 hours, or until there is no longer a fever of 100 degrees Fahrenheit or 37.8 degrees Celsius, limiting contact with others who are infected, getting vaccinated with the H1N1 vaccine as well as a seasonal flu vaccine before getting sick, washing hands frequently with hot soapy water, and covering the mouth when sneezing or coughing with an arm or a tissue, as well as not touching the eye, nose, or mouth regions with hands, limiting the distance between the person affected and the healthy person, using a face mask and/or respirator when the person needs to go out and interact with the public, having good hygiene, and taking antiviral medications that have acetaminophen or ibuprofen to help with the fever.
Created using Powtoon.